You know, some problems can feel absolutely hopeless, but for some people, there's a solution that is nothing short of life-changing. Today, we're going to talk about isotretinoin, a really powerful medication that takes on the toughest cases of severe acne. We'll break down what it is, how it works, and what that whole journey really looks like.
Before we get into any of the science, let's just start right here. Because this quote, it gets to the very heart of why this all matters so much. See, severe acne isn't just a skin thing. It's about how you feel about yourself, how you face the world every single day.
And we're not talking about a temporary breakout that clears up in a week. No, this is a persistent, often painful condition that can drag on for years, pushing back against every treatment you throw at it. It can leave behind scars you can see and scars you can't, creating this long, frustrating road.
So let's start with the part you can't always see. Section 1. Acne's unseen scars. Because honestly, this is where the real weight of the problem often lies.
Just try to imagine it, navigating your social life, your professional life, all while feeling this constant, nagging anxiety about your appearance. For so many, this was the daily battle, a struggle that just slowly but surely chips away at your confidence. But then, something shifted. A new chapter began, both for dermatologists and for their patients. Which brings us to Section 2, a powerful new hope. This was a real game changer. So what exactly is this big breakthrough? It's a medication called isotretinoin. But listen, this is not your typical acne cream. Think of it more like the special forces of skincare. It's a powerful pill that gets called in only when nothing else has worked. It's the last line of defense, and it's an incredibly effective one.
And this isn't some brand new experimental drug. Not at all. It was developed and tested back in the late 70s, got approved in the early 80s as a genuine breakthrough. And for decades now, it's been a scientifically proven, life-changing option for people all over the world.
So how does it pull off what so many other treatments can't? Well, the answer is in the science. Let's dive into Section 3, how the drug works.
This is where that factory reset for your skin happens. Isotretinoin doesn't just put a bandage on the problem, it gets right to the root cause and pretty much re-engineers the whole system. First, it actually shrinks your oil glands. Then it dramatically turns down the faucet on oil production. It also acts as this really powerful anti-inflammatory, calming everything down. And finally, it makes the whole environment on your skin hostile to those acne-causing bacteria. It's basically a forefront war on acne, and that's why it's so incredibly effective. But, and this is a big but, with that kind of power comes some serious responsibility. This medication demands respect, which brings us to a super important part of this story. Section 4, the treatment journey and its rule.
Right off the bat, you need to know this is not a quick fix. Taking isotretinoin is a real commitment. The treatment itself is a journey, usually lasting about 4 to 6 months. And the whole time, you have to work in a close partnership with your dermatologist, which means regular check-ins and blood tests to make sure everything's going okay. Okay, let's be absolutely crystal clear here. This power comes with some critical, non-negotiable rules. The most important one, the one that's underlined in bold, is about pregnancy. This drug causes severe birth defects, period. So it's absolutely forbidden for anyone who is pregnant or might become pregnant. That's why the safety protocols are so strict. Beyond that, it's not for folks with certain liver or cholesterol issues. And for every single patient, the rules are ironclad. Strict supervision by your doctor, and no donating blood while you're on it or for a month after. It's all about safety first and foremost. All right, so those are the hard rules. What about just managing the day-to-day? Well, the most common side effect is going to be serious dryness. So, constant moisturizing of your lips and skin, that's going to be your new best friend. Your skin will also be super sensitive to the sun, so a high SPF sunscreen every day is an absolute must. The whole game is just about being gentle with your skin and staying really, really hydrated. So, you navigate all the rules, the appointments, the side effects. What's the payoff? I mean, why go through all of this? That brings us to the reward. Section 5, Life After Acne.
It really all boils down to a fundamental trade-off. On one side, yeah, you've got the challenges, the side effects we talked about, mostly that intense dryness and sun sensitivity. But on the other side, the reward can be profound. We're talking about a radical, lasting change to your skin.
And with that comes the return of your self-confidence and the freedom to just live without that constant weight.
In the end, it's about so much more than just skin. The patients themselves, they describe a radical improvement that directly restored their self-confidence. That's the real goal here. And for so many, that is the incredible result. So let's bring this all home. It's a complex topic for sure, with a lot to weigh and consider. And that leads us right to our final takeaway.
The bottom line is this: isotretinoin can be a truly life-changing solution, but it's not a simple one. It is a serious medical journey that demands respect for the rules, patience for the process, and discipline in following your doctor's guidance. It's a partnership, through and through.
So you have this powerful tool for a really painful and deeply personal problem. And it leaves us with the one central question that every potential patient has to answer with their doctor. When is the risk worth the reward? That informed decision, that's the very heart of this entire journey.